The Nipah virus was first identified in 1999 during an outbreak in Malaysia. It is named after the village of Sungai Nipah, where pig farmers were affected by the virus. It was also recognized in Bangladesh in 2001, and nearly annual outbreaks have occurred in that country since. The disease has also been identified periodically in eastern India. Other regions may be at risk for infection, as evidence of the virus has been found in the known natural reservoir, Pteropus bat species, and several other bat species in a number of countries, including Thailand, Cambodia, Indonesia, the Philippines, Madagascar and Ghana. Fruit bats of the family Pteropodidae, particularly species belonging to the Pteropus genus, are the natural host for Nipah virus. There is no apparent disease in fruit bats. The virus is primarily transmitted to humans from animals, such as bats and pigs. Outbreaks of the Nipah virus in pigs and other domestic animals, such as horses, goats, sheep, dogs and cats were first reported during the initial Malaysian outbreak in 1999. The virus is highly contagious in pigs. Pigs are infectious during the incubation period, which lasts from 4 to 14 days. Nipah virus can spread to people from direct contact with infected animals, such as bats or pigs, or their body fluids such as blood, urine or saliva, consuming food products that have been contaminated, by body fluids of infected animals such as palm sap or fruit contaminated by an infected bat, close contact with a person infected with the virus, or their body fluids including nasal or respiratory droplets, urine, or blood. The symptoms of the Nipah virus include fever, headache, dizziness, vomiting, and acute respiratory syndrome. It has a high mortality rate, ranging from 40% to 75%. There are currently no drugs or vaccines specific for Nipah virus infection available. Treatment is limited to supportive care, including rest, hydration, and treatment of symptoms as they occur. To protect yourself from the Nipah virus, it is important to take preventive measures. Here are some recommendations. Avoid exposure to sick pigs and bats. The Nipah virus can be transmitted through contact with sick pigs and bats. Avoid close contact with these animals, especially if they appear to be ill. Avoid drinking raw date palm sap. Raw date palm sap can be contaminated by an infected bat. It is advisable to avoid consuming this sap to reduce the risk of Nipah virus infection. Practice good hygiene. Wash your hands regularly with soap and water, especially after visiting with someone who is sick. This can help prevent the spread of the virus. Stay updated with the latest information about the Nipah virus from reliable sources such as the Centers for Disease Control and Prevention and the World Health Organization. Awareness is key to lower infection rates. Recently, the Nipah virus has caused an outbreak in India. With 2 confirmed deaths, the Indian government has taken measures to contain the virus, including the closure of schools and offices. The World Health Organization has classified the Nipah virus as a priority pathogen due to its potential to cause a global epidemic. It is important to take preventive measures to avoid the spread of the virus. Throughout this documentary, we have explored the deadly Nipah virus and its potential to cause global outbreaks. The high mortality rate and ease of transmission make it a significant public health concern. By staying informed, following guidelines from reliable sources such as the Centers for Disease Control and Prevention and the World Health Organization, and taking necessary precautions, we can work together to safeguard our well-being and protect our communities from the Nipah virus.